On this Wednesday night, tough restrictions return to parts of Quebec. What the exponential spread of the variant is doing, who is getting sick, and what needs to be done.
The light is at the end of the tunnel, but the risk is so high.
News about a clinical trial on children of the Pfizer-BioNTech vaccine, what it revealed, and are vaccines for kids coming soon? Tearful testimony. A man who pleaded with police as an officer knelt on George Floyd's neck takes the stand. And a PR stunt veers off the road.
At first, when I heard it, I was pretty shocked.
How Volkswagen's joke backfired.
Global National with Dawna Friesen.
Good evening and thanks for joining us. As we approach April and more Canadians get vaccinated, hope is being tempered by what's happening in hospitals in some parts of this country. COVID-19 cases are rising, driven by the more transmissible variants, and younger people are getting sick. Only two things will stop the spread: vaccines and staying away from each other. Late today, Quebec's premier announced tighter restrictions are being reimposed in 4 regions there, and 3 cities will be under lockdown measures. Starting tomorrow night in Quebec City, Gatineau, and Lévis, all non-essential businesses and schools will close, and the cities will be under an 8 p.m. curfew until April 12th.
So everywhere in Quebec, we have to be more careful. With the variant, we can see an explosion of cases within a few days. We're ready to act quickly and strongly if the situation worsens in other regions.
This is the picture across the country today. BC, Alberta, Saskatchewan, and Ontario have the highest active cases right now. Those 4 provinces are also reporting some of the highest rates of the new variants. And hospitalizations are climbing too. Intensive care units are filling up. There are 80 critical patients in BC now, 63 in Alberta, and 23 in Saskatchewan. And today, Ontario hit a new record. Data from Critical Care Services shows 421 patients in ICUs. That is the highest number since the pandemic began. The message from all public health officers heading into the holiday weekend: now is not the time to get together.
If you gather as usual, you are taking a great risk. It is just an invitation to COVID-19 variants to spread.
How many times have we heard that over the last year? It is hard to accept, but these new variants are changing the game, and they aren't waiting for politicians to decide what to do. Abigail Bimman has our top story tonight.
Pandemic Passover, Easter, and Ramadan, round 2.
If we could go through one more cycle of those holidays where we forego that getting together with people other than those with whom we live, then not only will we keep people healthy, but we will be able to enjoy everything else in fairly short order.
With more vaccines coming, there's more optimism about a future kind of normal, but not in time for the holiday weekend.
We continue to ask people to stay in their household family unit as tightly as possible.
It's been a long haul. We've all got the fatigue, and unfortunately, we're not quite there yet. The light is at the end of the tunnel, but the risk is so high, especially with the numbers climbing exponentially.
The scientific director of Ontario's COVID-19 advisory table says a year into this, it's important people try and enjoy themselves, but safely and outdoors.
This is not about big gatherings. It's perhaps about seeing another family from a distance.
With cases rising and variants spreading, BC and Saskatchewan have added or extended restrictions.
Talk is cheap right now. Action is what I think we need.
This epidemiologist is especially concerned about people gathering indoors to worship, even if masked and distant.
You are not sure exactly how the ventilation, is occurring, and you really just don't want to pick up the variant that is circulating in the community.
Ontario's premier faces criticism for not imposing more restrictions faster.
Stay tuned. You'll hear an announcement tomorrow, but I'm very, very concerned to see the cases go up.
Why is the premier stringing people along?
Ottawa is asking the province to move the city to the grey lockdown level, getting rid of indoor dining.
Our healthcare system is stretched. Cases are rising, hospitalizations are increasing. The testing centers are maxed out.
We've never had ICU occupancy as high as it is right now.
Dr. Peter Uni is ready to release new modeling Thursday, but says at this point we don't need new numbers to understand the severity of Ontario's problem. Abigail Bimman, Global News, Ottawa.
To help put all of this into context, Dr. Ronald St John joins me. He's an expert in public health and infectious disease control. Dr. Toronto's public health officer said today that in the race between the variants and the vaccines, the variants are ahead by a mile. What is your greatest concern right now?
Yeah, my concern about the variants is twofold. Number one, they are more easily transmissible, and they do appear to be to cause more illness and potentially death than the normal strain. The other concern is that they tend to be infecting more younger people. I'm told that the hospitals are beginning to see a younger group of patients. I'm talking between, say, 30 and 50.
There are calls to change the vaccination strategy, not just to be age-based, but to vaccinate essential workers, people who work in congregate settings. A lot of those are younger people. Some provinces are starting to do that. Do you think it's a wise idea?
Well, there are two aspects of the vaccination. One is vaccinating people who are at high risk of becoming seriously ill, going to the hospital, occupying our intensive care unit beds, and having a bad outcome. And those have been the elderly people. But we also have to realize that younger people are also transmitting the disease. And to the extent that the vaccine will stop transmission, still probably true, but still under investigation, then there's a need to vaccinate the younger people.
So do you think tighter restrictions need to be put in place now?
I do. The Australians are interesting to learn from. The city of Brisbane, with 2.5 million people, had 7 cases and they shut down. Ottawa has 1 million people and we had over 100 cases and we haven't really shut down. I think there's a lesson there.
All right, Dr. Ronald St John in Ottawa, thank you.
You're welcome.
Well, it's still just a press release from the company, and it has not been peer-reviewed, so there are lots of caveats at this stage. But Pfizer-BioNTech says a small clinical trial involving just over 2,000 children has shown its vaccine is safe and effective in children aged 12 to 15. The initial clinical trials on all the vaccines were done on adults. That is now slowly changing. It doesn't mean COVID-19 vaccines are being made available to children yet, but as Eric Sorensen reports, it is a step down that road.
12 to 15-year-olds are a small part of the population, but Pfizer's breakthrough may protect a group that vaccine trials have so far overlooked, children and teens. The bodies of children are different enough from adults that vaccines often have to be adjusted. But this small trial found, at least for young teens, the vaccine is 100% effective.
It is very good news that the Pfizer vaccine is effective in teenagers. Increasingly, we've seen young and middle-aged adults show up in the hospital. So let's get our teenagers vaccinated. They can go back to school, engage in their social activities.
In Canada, as in the U.S., the Pfizer vaccine is approved for everyone over age 16. For 12 to 15-year-olds, Pfizer is initially seeking emergency approval in the U.S. And for kids up to age 11, trials are now underway. Protecting young people increases the prospect for herd immunity to bring the pandemic under control.
We want to get the people who are at risk for the highest risk for severe disease vaccinated first, and children will be part of the equation later on down the line. But yes, they are a key element into getting herd immunity around the province and the world.
Okay, 2, 3. All done.
Susanna Nagy's twin 9-year-olds are among 48 kids in another Pfizer trial for children as young as 5.
This is an opportunity for us to both potentially get our kids access, but also to contribute to knowledge in how safe this is for kids.
Moderna is also conducting trials on children. For now, getting teens vaccinated would not only allow schools to operate more safely, it could restore teenagers' necessary social development that's been taken away for the last year.
Teenagers do get together socially all the time. It's part of their maturation process, and that'll help us get back to a semblance of normal.
The results are preliminary and have not been peer-reviewed. And while approval by Health Canada is expected to take a few months longer, in the U.S. it's hoped that young teens will be vaccinated before the next school year starts this fall. Eric Sorensen, Global News, Toronto.
A group of politicians held a photo op today to announce they are investing $925 million of taxpayer money in a plant run by the French pharmaceutical company Sanofi. The idea is to develop domestic vaccine production here in Canada. Not for badly needed COVID-19 vaccines, but for flu vaccines. The plant will take years to complete, and as Travis Danraj explains, it does nothing to help with the health crisis happening right now.
It is a significant booster shot to Canada's ability to tackle what may come after COVID-19, an investment that is set to strengthen vaccine manufacturing in this country.
If there's one lesson learned, it is that we need to have a strong Canadian biomanufacturing sector.
The joint venture between French drug maker Sanofi and all three levels of government will help build a nearly $1 billion production and distribution facility in Ontario. The location and expansion of the existing site in Toronto will increase influenza vaccine manufacturing and serve to formulate new drugs.
We are now never going to have to rely on any country, any leader. We'll be self-sufficient.
Around 1,200 jobs are expected to be created as a result of the project. In addition, Sanofi is promising to inject at least $79 million a year more into Canadian research and development of drugs.
Sanofi could choose to really do this type of manufacturing anywhere. The fact that they've chosen Canada is a great news story for Canadians.
Good news, but Canada has struggled to solidify domestic vaccine production since the pandemic began. In May 2020, Canada made a deal with Chinese manufacturer CanSino Biologics, but there were shipping delays and red tape, and clinical trials were canceled. Delays retooling the National Research Council's Montreal facility meant Canada needed to rely solely on foreign supply. The new Sanofi project is not expected to be completed until 2027. Still, many experts are optimistic.
I think this is big, but we may have further pandemics. And one of the things that we should learn from this one is how we can be better prepared.
Sanofi says the new facility will have the capability of producing enough flu vaccine doses for the entire Canadian population within 6 months of the World Health Organization identifying a pandemic flu strain. Good news for the future as we look forward to getting out of the pandemic we're currently in. Travis Danraj, Global News, Toronto.
Breaking down on the witness stand, coming up, a bystander who challenged the police during George Floyd's arrest testifies. Plus, an ex-con is the suspect in that brutal attack on an Asian American woman, his gruesome criminal record. And ready to splurge, the signs a spending wave is coming. Video of another angle of the arrest of George Floyd was entered into evidence today at the trial of the officer accused of killing him. It's police body cam footage, and like all the other video of those terrible moments, it is difficult to watch. We are not showing all of it.
I can't breathe. I can't breathe. Please, man. Please do this to me. Is he going to jail? He's under arrest right now for forgery.
We've stopped the video at this moment. It goes on to show the officers struggling to get Floyd out of the vehicle. A 61-year-old man who witnessed it all from just steps away broke down in court today after watching that footage. Charles McMillan said he pleaded with Floyd not to struggle and begged officers to stop pinning Floyd to the ground.
Oh my God. I asked them to let him up so he can't breathe. And then even I said to the officer, I said, man, he said he can't breathe. Have money. They said, well, if he keeps talking, he can breathe.
McMillan described seeing Floyd going in and out of consciousness and having foam at his mouth while Chauvin pressed his knee on Floyd's neck. Chauvin is charged with second and third-degree murder as well as second-degree manslaughter in Floyd's death. He has pleaded not guilty on all counts. New York City police have arrested a suspect in that vicious attack on an Asian American woman. A warning video of this attack is also hard to watch. The man seen in this surveillance video has been identified as 38-year-old Brandon Elliott. Police say he has a violent past. He was convicted of stabbing his mother to death in front of his 5-year-old sister in 2002. Police say he was released on parole in November of 2019. He is accused of kicking the 65-year-old Filipino woman to the ground and stomping on her outside an apartment building in Midtown Manhattan. Police say the suspect shouted, "You don't belong here," as he did it. He's facing several hate crime-related charges, including felony assault. Roaring 20s in the 21st century still ahead. What our next reality could look like. Statistics Canada has released the first economic numbers for 2021, and so far so good. The economy grew 0.7% in January. That is the 9th monthly increase in a row since the GDP took a plunge last spring. The growth is better than expected, though Stats Canada says economic activity is still running about 3% below pre-pandemic levels. The positive start to the year is boosting consumer confidence, at least for those who have jobs. Economists at the Conference Board of Canada are predicting big things for 2021. And as Anne Gaviola explains, we could be on the cusp of a roaring 20s revival.
The Roaring 20s swept across America after the deadly 1918 flu pandemic. The similarities between then and now are striking. Technological advances were drastically changing people's lives. The stock market was soaring, and people were ready to cut loose and spend money.
I'm going to try and say yes more.
Brianna Davies has big plans for when things get back to some semblance of normal.
Having so many of the things we take for granted every day gone, like the ability to go grab a glass of wine with a girlfriend at a new little spot.
Canadians have been saving like never before. Collectively, we've stockpiled more than $200 billion worth. Now, a lot of that has found its way into the stock market, been used to pay down debt or to renovate and buy homes. But economists estimate there's more than $100 billion worth just waiting to be spent. A big pickup starting in July and carrying until early 2022. But supply chain experts say headaches are in store. A flurry of shoppers may mean shortages. Remember what happened with toilet paper at the onset of the pandemic. But economists warn that if shoppers are spooked by higher prices, they may rush out to buy things before prices skyrocket, creating shortages and stoking inflation.
So there's a sort of self-fulfilling prophecy that could occur if there's an increase in inflation expectations.
This Roaring 20s style comeback is dependent on some moving targets: the pace of the vaccine rollout, the consequences of the more contagious coronavirus variants, the impact of new financial aid from Ottawa, as well as the time it takes for the ripple effect of the nearly $2 trillion in stimulus from the U.S. to jolt Canada's economy. Brianna's family is dreaming of the day they can travel again. Their bucket list safari vacation to South Africa was cut short by the pandemic last March.
I really rely on travel as a bit of an escape to, hang out with my family. The feeling of looking forward to a trip, and not just the actual trip, but planning the trip and looking forward to it, gets me through a lot of stressful, long days.
Anne Gaviola, Global News, Toronto.
U.S. President Joe Biden is ready to spend money, and a lot of it. Today, he unveiled his plan to help America build back better.
What I'm proposing is a one-time capital investment of roughly $2 trillion in America's future, spread largely over 8 years. It will generate historic job growth, historic economic growth, help businesses to compete internationally, create more revenue as well.
Biden hopes to create millions of jobs by investing in infrastructure across the country. The projects would be financed in part by an increase in corporate taxes. The plan still needs to be passed by Congress. Next, did an automaker's prank backfire? We've all heard the saying, there's no such thing as bad publicity. Well, Volkswagen definitely got lots of publicity this week, but lots of people are talking about it for all the wrong reasons. The German company says what happened this week was an early April Fool's joke. And as Mike Armstrong explains, not everyone is laughing.
Now, there's nothing strange about what Volkswagen was trying to do. Another reporter might have said nothing shocking. It's the same thing it set out to accomplish with this recent act.
I think we're done, yeah?
To get the public to associate VW with electric vehicles.
On our way to carbon neutral mobility for all.
Now, it's one thing to do this. It's another to do what the company did Tuesday. It pretended to accidentally leak a name change with this Twitter video becoming Volkswagen.
That's volts as in electricity.
Well, if journalists were fooled, and many were, there were reasons. Volkswagen issued a press release quoting its CEO, and when reporters called to confirm it all, they were reassured it was true.
All EVs in the US will have Volkswagen badging on the rear.
Para convertirse en Volkswagen.
The news went around the world on TV and online, from the USA Today to publications back in Volkswagen's home country, Germany. Well, Tuesday night, a retraction. The company issued a statement explaining it was all in the spirit of April Fool's Day. Some of the journalists who covered the story didn't end up laughing. The USA Today's Nathan Bomey tweeted out a message, "Dear Volkswagen, you lied to me. You lied to AP, CNBC, Reuters, and various trade publications. This was not a joke. It was deception."
It's wrong. It's just simply wrong. And
marketing expert Robert Soroka says VW broke some rules of advertising, but may have also broken some laws. Volkswagen stock jumped about 5% when the prank news broke.
This is a manipulation of the market, and it's done in a way that's unfair. It's done on the premise of a lie.
E-mobility
Now, this supposed prank comes with Volkswagen still trying to rebuild its brand. After the 2015 emissions scandal, the company had to pay out $45 billion in fines and settlements. One marketing expert says that may be the biggest problem with the prank. It's related to the environment, the same issue it got into trouble for the last time. Mike Armstrong, Global News.
And that is Global National for this Wednesday. I'm Dawna Friesen. This is International Transgender Day of Visibility, and there are plenty of Canadians to celebrate. Here are just a few, listed by one of Canada's largest unions. In Toronto, there's Raven Wings, a Black Indigenous artist and activist. Monica Forrester has spent 2 decades fighting for the rights of trans people and sex workers. Manitoba's Cale McKenzie is Canada's first transgender judge, and Alberta's Vivek Shreya and Yukon's Ivan Coyote are award-winning authors, musicians, filmmakers, and educators. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.